Hi everyone, this is Nitin Choda, physical therapist with Nitin360.com. Now, in this video training, I'm going to talk about one of the most critical questions that most private practices ask themselves about. The question is, when do I hire a new staff physical therapist? Now, it's a bit of a catch-22. In order to grow your practice and increase revenues, you need to be able to hire more physical therapists. Yet, when you hire a new physical therapist, you're taking on a new expense, a significant expense, probably bigger than all your other expenses. So therefore, it's a bit of a catch-22. But the fact of the matter is, hiring a new physical therapist is a good situation to be in. It's a sign of growth in your clinic. It's something you should definitely do by all means, so that you can increase revenue, so that you can create jobs, so that you can basically live a life of freedom and independence. The big question is, when do you hire a new physical therapist? Now, there are 4 factors that will actually help you determine whether you should be hiring new physical therapists or not. Now, the first factor is that the existing physical therapist, whether it's you, whether it's someone else, whoever the existing PT is, should have a full caseload. Having a full caseload is extremely important. Now, there are different schools of thought about what a full caseload should be, but it's safe to say that anywhere between 50 and 60 visits a week constitutes a full caseload. Think about it. If someone's working full-time 40 hours a week, they should be able to see at least 40 visits, preferably anywhere from 50 to 60 visits. It all depends, of course, on the complexity of the patient, on the skill and the technique of the physical therapist, on the type of treatment, whether modalities were used, manual was used, and so on and so forth. But the first factor basically is that the physical therapists on staff should have a full caseload, so that their schedule is pretty much maxed out. They aren't empty slots, they aren't empty holes in their schedule. That's the first factor. The second factor is the full caseload should exist at least for a period of at least 8 weeks or more. So if a physical therapist has had a full caseload for at least 2 months, you can be fairly certain that the full caseload is not just a bit of a fluke. It's actually a sign of a successful practice and of growth in the practice. So number 1, having a full caseload. Number 2, having the caseload for at least 2 months or more. So keep that in mind. Now, the third factor that'll sort of give you an idea about whether you should be hiring a new physical therapist is, how long does a patient have to wait to get in for the initial evaluation? If a patient has to wait for more than 3 or 4 days to be seen by you in your clinic, that tells you that you're extremely busy. That tells you that it's time to hire a new physical therapist. Because think about it, if a patient is waiting for more than 3 or 4 days, number 1, they're going to look somewhere else. Number 2, the referring doctor is now, you may not find this out until it's too late, but the referring doctor might say, you know what, they're too busy, I'm just going to send the patient somewhere else. So again, don't be complacent and assume that patients will wait, doctors will wait. There's a bit of a breaking point, and you don't want to sort of test that, because once you start to lose the patient and the referral sources, you're not going to be in the happy situation of having a backlog of patients. So if a patient's waiting more than 3 or 4 days for an eval, you need to sort of look critically at your schedule, how the scheduling is being done, or you may just need to hire a new physical therapist. So those are 3 points. Now, the fourth point is, most patients, a lot of patients I should say, generally come to physical therapy at least 3 times a week. If you're so busy that you cannot see a patient 3 times a week, and now the patient is being seen twice a week instead of 3 times a week, that's a bit of a warning sign. Either there's something wrong with the way you're scheduling patients, or you're just too busy and you need to hire a new physical therapist. So there you go, 4 points, 4 factors that'll give you a very clear indication of whether you need to be hiring a new physical therapist. A full caseload, having a full caseload for at least 8 weeks or more, the length of time a patient has to wait for an evaluation, and finally the number of patient visits. Does that have to be cut down only, you know, simply because you're too busy. So keep these things in mind. I'm all in favor of hiring more physical therapists, growing your practice, and I hope you can do that and live a life of freedom and independence. That's exactly how my coaching clients and my mastermind clients grow their business, reach their goals, and are able to sort of take time off, spend time on the beach. This beautiful beach right here. This right here is I'm at the beach here in Coronado Island in San Diego, and I hope that you can do something like this as well. So thanks so much for watching. I hope this video training was beneficial, and I'll see you in the next training. Bye.